Hi, this is Dr. Bharadwaz. I am CEO and Chief Doctor at Fidicus Homeopathy. Today we will discuss on the topic of pattern baldness. This is the common baldness among the men. 50% of the men will suffer with this baldness in their life. It is much lesser in women compared to men. There is no any significant disability or inconvenience with this. The problem with this is the men with baldness will have low self-esteem. It reduces their mate value. If we consider they have some value in the market as a mate, it reduces their value. And also especially if this baldness occurs is in the young people, this is much traumatic to them. Other than that, it will not cause any harm to the person as such. Coming to the different names of this baldness, it is also called male pattern baldness or female pattern baldness or androgenetic alopecia or fibrotic alopecia. It is very important to understand these names as well. It is called male pattern baldness because it has a specific pattern of baldness. In males, what happens is the frontal area, means the area here, there is loss of hair on the frontal area, and also in the crown, in the top part of the head, there will be hair loss. Sometimes it will be frontal, sometimes it will be on the top, most of the times it will be from both sides. This is the pattern we can see in male pattern baldness. And in women there is also a pattern. In women, what happens is there will not be any complete receding of the hairline or loss of hair in the particular region. It will be diffused, especially on a complete head there will be loss of hair completely. It's a diffuse one. There is no specific area the hair is lost. The hair is lost in the whole of the scalp. This is also called androgenetic alopecia because the reason for the hair fall is some androgens, especially dihydrotestosterone. It's an androgen. That's the reason we call it as androgenetic alopecia. We call it as genetic because there is genetic predisposition for this. So if your father or mother or any one of your relatives has this, there is high chance that you get this hair fall. And also it is also called fibrotic alopecia. The reason for this is when the hair falls out, the follicles of the hair turns into fibrous tissue. That's the reason it is also called fibrotic alopecia. In advanced stages, what happens is there will be permanent loss of hair. Once the hair is completely lost or hair follicle is completely lost, you cannot recover it. You have to go with transplant. So what are the signs and symptoms? In men, what happens is the hair will reside from the frontal area or from the crown or from both the places. In women, what happens is there will not be a particular place where the hair is lost. It is diffused. Women loses hair throughout the scalp. Coming to investigations, there is one specific investigation, that is called trichoscopy. Under trichoscopy you can clearly examine that there will be loss of hair, and in the follicles where the follicles are present, they are turned into scar tissue or fibrous tissue. You can clearly observe in trichoscopy. In order to understand this disease completely, you have to understand anatomy of the hair follicle. Hair follicle is a small tube-like structure which is located on our skin. See, there are three layers in skin. Upper layer is epidermis, middle layer is called dermis, and lower layer is called hypodermis. This tube-like structure or hair follicle is present in dermis and epidermis. It doesn't reach hypodermis. So it is a tube-like structure. In this tube-like structure, at the base there will be a papillae. So from this papillae, the hair is growing, and this papillae or the entire hair follicle is supplied through arteriole. So arteriole supplies arterial blood, and there is venous drainage. We call it as venule. Venule drains the blood away from this hair follicle, and also it is surrounded by a small nerve, sensory nerve. So complete hair follicle is surrounded by a small sensory nerve. This is about anatomy of the hair. Coming to physiology, there is one important thing you have to understand about the hormones. Basically, testosterone is released by the testis. Okay, and this testosterone is converted into dihydrotestosterone with the help of an enzyme. The enzyme is called 5 alpha reductase. This dihydrotestosterone is going to affect your hair not only on scalp and also on other parts of the body. So what happens is all these hair follicles have dihydrotestosterone receptor in them. So the hair which is present in scalp or which is present in any part of the body, they will have dihydrotestosterone receptor. The function of dihydrotestosterone receptor is different in scalp, and also it is different in other parts of the body. In scalp, what it does is it takes dihydrotestosterone in the scalp. This receptor which is present in the hair follicles of the scalp take this dihydrotestosterone, and this dihydrotestosterone is going to reduce the hair follicles in the scalp. So what it does is it miniaturizes, means it destroys the hair follicles in the scalp. The same dihydrotestosterone receptors which are present in other parts of the body other than the scalp will take the dihydrotestosterone and it will increase the hair growth. It increases the thickness of the hair. It increases the strength of the hair. So same hormone, same receptors in two different places have different effect. In scalp, it damages the hair follicle. In other parts of the body, it strengthens the hair follicle and increases the growth. Same hormone, same receptors, but exactly opposite functions in two different places. What are these two different places? In scalp, it damages the hair follicle and decreases the hair there. And in other parts of the body, where your eyebrows, your eyelashes, or your beard, or your mustache, or your body hair, or pubic hair, anywhere these receptors take up the dihydrotestosterone and it will increase the strength of the hair and it will increase the thickness of the hair and makes the hair permanent all over the body. And what are the reasons or what are the causes for this hair loss? It is purely genetic, it is multifactorial, and all these factors are genetical factors only. It purely depends on your genetics. Coming to the pathology, pathology means what are the changes in your hair follicle or your body when you have this androgenic alopecia. What happens is testosterone is a hormone which is produced in the body mainly through testis, and this testosterone is converted into dihydrotestosterone with the help of an enzyme 5-alpha reductase. This dihydrotestosterone has a major effect on your scalp. What happens is on scalp there will be hair follicles. These follicles contains dihydrotestosterone receptors where they can uptake the dihydrotestosterone. When the hair follicles having dihydrotestosterone receptors take the dihydrotestosterone hormone, what happens is it damages the hair follicle. It miniaturizes the hair follicle, means it will shortens the hair follicle. It make the hair follicle thin, and finally over a period of time the hair is completely lost and there will be a scar formation in this place. The dihydrotestosterone will affect the follicle. What it does is it will cut off the arterial supply, it will cut off the venous drainage, it will damage the nerves around the hair follicle, and also it will damage the villi which is going to produce the hair. So by all this action, your hair is completely lost from the scalp. Basically, what happens here is there will be miniaturization. The hair follicle becomes thin, the hair follicle becomes small, and also finally there will be falling out of hair and there will be permanent loss of hair and permanent loss of hair follicle, and scar tissue appears in the place of follicle. What is the conventional treatment? Conventional treatment is better in this case compared to homeopathic treatment, because in conventional treatment there are medicines which can inhibit the dihydrotestosterone action. They can destroy the dihydrotestosterone within the scalp or any part of the body, so that the hair follicles which are miniaturized will grow back, will again increase in length, again increase in thickness, and they will produce hair again. And if the hair is completely lost, there is already scar tissue formation, you can go with the hair transplant. Hair transplant means they will take the hair from other parts of the body or other parts of the scalp and implant in the places where the hair is lost. In allopathy or the conventional treatment or western form of treatment, the result is very good for androgenic alopecia. And coming to the homeopathic treatment has no much effect here. So then compared to homeopathic treatment, allopathic treatment is much better. So there is some limited scope in homeopathy. What homeopathy can do is this allopathic treatment, when you go for hair transplant surgery or dihydrotestosterone inhibitors, what it does is there will be lot of side effects, like there can be infection or there can be other side effects. So these side effects can be counteracted by homeopathic treatment. If you take allopathic drugs along with homeopathy, your hair growth will be more, your thickness of the hair will be more, your strength of hair will be more, and you will be less prone to infections after the surgery. So here, compared to allopathy, homeopathy is not much useful. So the success rate here in homeopathy is less than 5 or 10%. So we suggest you to go with allopathic treatment in case of androgenic alopecia. So on coming to the precautions, there are no much precautions especially you can take for androgenic alopecia. Here what you have to do is you have to take healthy diet, you have to exercise regularly, you have to lead a stress-free life, and you have to have good amount of sleep every day. So other than that, there are no specific uh, precautions you can take for this androgenic alopecia. And coming to the prognosis, what happens if you don't take action at the earliest stage? So your hair follicles will be completely damaged. Once your hair follicles are completely damaged and scar tissue is formed, then you have to go with surgery. Surgery has lot of side effects. If you don't take care of this disease in early stages, the number of hair follicles you can get during surgery or transplant will be very low. And with low number of hair follicles, the hair will be thin even after the surgery. So take allopathic treatment as early as possible when you have androgenic alopecia. Thank you.